educating our girls and our women about their reproductive options is healthcare. And in Maryland, we will lead the fight to expand access to healthcare, so we need to talk about the importance of contraception. And the reason today matters is because of this. Because despite being a basic healthcare need, contraceptive care is often considered a specialty service. We know that 294,640 Maryland women live in contraceptive deserts, that they can't easily access care. We know that Maryland has one of the highest rates of unintended pregnancies in the nation. We must do a better job of ensuring that when a Marylander walks into any doctor's office, that they can get connected to contraceptive care. And so today, I'm very proud to announce that the state of Maryland is partnering with Upstream USA to deliver training, education, and technical assistance on contraceptive care to Maryland healthcare providers free of charge. Under this partnership, we will help ensure that more of our healthcare providers are trained on how to deliver contraceptive care. Under this partnership, we will bring contraception to communities that have too often been overlooked and undervalued, including our rural communities. And under this partnership, we will build on Maryland's growing reputation as a state that is ready to lead on healthcare and close the gaps in healthcare supports and the gaps within our healthcare system. And our work begins right here, right now, because we are proud to announce that we've also selected our very first partner for this initiative, CCI Health Services. CCI has earned a reputation as a trusted provider for Marylanders of all genders, all races, all ethnicities, and all ages in Montgomery and also in Prince George's County. They are pioneers in patient-centered care and have set the standard for the kind of profound impacts that our community health centers can have. And so I believe in reproductive health, and so does Maryland. I believe that the decision to have an abortion should be between a woman and her doctor and nobody else. No governor, no state legislator, no judge, no person. But I also believe this. It is imperative that we invest in and we believe in our women and girls and believe in them enough to make sure they're getting the resources to learn about family planning options before abortion care even needs to be an option. If we're going to be serious about bodily autonomy, if we're going to be serious about closing the wealth gap, if we're going to be serious about allowing our women and our girls to realize their economic goals and their familial aspirations, then we need to focus on family planning. And today's partnership is an important step to make that happen. As I said before, and I'll say it again, Maryland is going to lead. And we will do it by making sure that we leave no one behind. And that includes our young women and girls who will benefit from this nation-leading partnership between Upstream and the state of Maryland. To speak more on this, I'll proudly turn the microphone over to our spectacular Lieutenant Governor, Aruna Miller.
Thank you, Governor. Good morning, everyone. Hope you all enjoyed your Thanksgiving holiday. So it's wonderful to be here this morning with Governor Moore, Secretary Dr. Laura Herrera Scott, Team Upstream USA, and Team CCI, as we announce this significant partnership to enhance access to patient-centered contraceptive care. Governor Moore and I have been steadfast in our commitment to prioritize reproductive health care in Maryland. On day one of our administration, we released the $3.5 million previously inaccessible funding to train reproductive health care providers. In April, Governor Moore signed into law legislation allowing Maryland's public colleges and universities to offer reproductive health care services and plans, including students' easier access to contraception. We also joined forces with Speaker Adrian Jones, Senate President Bill Ferguson, and the Maryland General Assembly, where Governor Moore signed into law legislation that puts Maryland on a path to permanently protect the right to choose in our state's Constitution. Our commitment is unambiguous. Maryland will be a sanctuary for reproductive health care choices. However, true choice extends beyond mere legality. It hinges on accessibility. Persistent economic, geographical, and racial barriers hinder many from making fully informed choices about their reproductive health. It's because of these barriers and more that too many Marylanders, including the 285,000 women who lack reasonable access to reproductive health care, Upstream's technical support will empower our extensive network of healthcare teams to amplify access to contraceptive care, with CCI leading the way to provide high-quality, accessible care for those who live in medically underserved communities. By investing in reproductive health care, we invest in fundamental rights, health, and empowerment of individuals, creating a more just and resilient Maryland. And this is why our partnership with Upstream USA is a vital investment in equity. Now I'd like to welcome Maryland Secretary of Health, Dr. Laura Herrera-Scott, to share her remarks.
Good morning. Thank you, Governor Moore and Lieutenant Governor Miller. Ladies and gentlemen, as already said, Laura Herrera-Scott, Secretary of Health, and I am so excited to be here to celebrate our ongoing commitment to ensuring that health and well-being of every Maryland resident. I am thrilled to echo the Governor's remarks about the partnership between the State of Maryland and Upstream USA. To me, this collaboration stands as a testament to our department's commitment to provide every Marylander with the proper health care they deserve. As Governor Moore emphasized, health care is a fundamental right, and contraceptive care must be an integral part of that fundamental right. Despite being neighbors to outstanding health care institutions, too many individuals in our state still face barriers to accessing birth control method that works best for them. This partnership with Upstream is a significant step towards breaking down these barriers and creating new pathways for equitable, patient-centered contraceptive access. Our collaboration will focus on increasing equity to contraceptive care by providing free technical assistance, training, and education in primary care settings. This partnership builds on Maryland's legacy as a national leader in healthcare access, showcasing our willingness to innovate and break down barriers to improve lives. In the current reproductive health landscape, access to contraceptive care is more critical than ever. While dedicated family planning clinics and OBGYNs will always remain experts, there is a clear and necessary role for primary care providers in the delivery of contraceptive care. Upstream's collaboration with Maryland complements Title X offerings, ensuring that there is no wrong door to access birth control. By addressing barriers to access, we are not just preventing unintended pregnancies, we are promoting overall health and well-being for every person and family. The Department of Health will continue to foster these types of relationship and innovative techniques as we seek to bring all-encompassing health care to Marylanders in need. Thank you, and may this partnership be a beacon of progress and equity in health care for our great state. And with that, I would like to introduce Mark Edwards, CEO of Upstream, who has helped to make this all possible.
Thank you, Secretary. My name is Mark Edwards. I'm the CEO and co-founder of Upstream. Established in 2014, Upstream is a mission-driven organization focused on ensuring that equitable, patient-centered contraceptive care is basic health care. We carry out this work by partnering with healthcare providers of all types to address the barriers that stand in the way of their patients' access to the full range of contraceptive services in a single visit. By offering free technical assistance and education and training, we support our healthcare partners by helping them integrate high-quality contraceptive care in the places where patients already receive their health care, in the primary care setting, not just in family planning specialty clinics, which can be few and far between. The change we create in partnership with healthcare providers ensures all people have access to the contraceptive care they want, when they want it, and where it is convenient for them to have it. We're at a crucial point in our history where there should be no wrong door for patients to access birth control. For Upstream, that means expanding our footprint to partner with providers in 24 states, including North Carolina, Texas, Colorado, Louisiana, Washington, and Indiana. And now, thanks to the leadership of Governor Moore and Secretary Herrera-Scott, we can add Maryland to that growing list. I am excited and humbled by the opportunity to partner with the state of Maryland. It was clear from our very earliest conversations that we were united by a shared commitment to make patient-centered contraceptive services available to every Marylander wherever they seek care. On top of a legacy of healthcare innovation, Maryland has a robust network of primary care providers who are already trusted sources of care and preventative health services for their communities. Through this partnership, we can help ensure these providers are strongly positioned to support their patients' birth control needs. Today, I'm also grateful to be standing with Dr. Bruton, the CEO of CCI. CCI is Upstream's first Maryland healthcare partner. CCI's commitment to an equitable healthcare system for everyone makes them the perfect first partner to join us in this effort. I commend Governor Moore, Secretary Herrera-Scott, Lieutenant Governor Miller, and Dr. Bruton for prioritizing contraceptive access for all Marylanders, and I thank every healthcare worker who will play a role in transforming the delivery of contraceptive services across the entire state. I'll now turn it over to Dr. Bruton.
Good morning. As Upstream's first healthcare partner in Maryland, I'm pleased to be here to discuss the benefits of the partnership. CCI is a 51-year-old federally qualified health center that provided medical, dental, WIC, and behavioral health services to 64,883 Montgomery and Prince George's County residents in 2022. We've been providing contraceptive services as a Title X grantee for 14 years, and last year alone, we completed 2,600 contraceptive visits. Our partnership with Upstream is beginning this year, and it's allowing us to more seamlessly integrate family planning at every touch point. They're working with us to fortify our program's infrastructure. This includes making sure that every member of the care team is comfortable discussing contraception and that every resident we touch has the opportunity to learn about all the pregnancy prevention options and how to make the choice that is best for them. They include visual aids, scripts, explanations, and best of all, a display of all the options that gives the patients the ability to delay, limit, or expand their families through a method that does not require them to compromise. For example, if introducing hormones triggers some fear or reaction that you'll have some later in life health complication, their teaching allows us to just shift the conversation to a non-hormonal option that has equal efficacy. Our mission is to deliver accessible care and lead the way to a more equitable healthcare system for everyone. We plan to foster a healthy and empowered community for generations, but we know that can't be achieved alone. Healthcare is always evolving, and partners like Upstream keep us at the forefront of best practices and innovation. We see integrating contraceptive conversations into the fabric of all of our visits as a vital step toward achieving equity. Knowledge and access empower all members of a community, and Upstream leverages both in their approach. As the product of a teen birth, I know firsthand that nothing can change the trajectory of someone's life like a pregnancy. At CCI, we say family planning is for the whole family because a pregnancy, unplanned or planned, makes waves that touch everyone in the household for the foreseeable future. Federally qualified health centers like ours understand that culture, education, access, and economics impact health and well-being. We're so grateful to have partners like Upstream who are aligned with our efforts and our philosophies. We're looking forward to our continued partnership and offer our ongoing support to the health initiatives of the Governor's Office. Thank you.
Sure. So our goal is to ensure that patients get access to the full range of contraceptive services as a regular part of primary care. That starts with ensuring that they get asked a pregnancy intention screening question as part of standard care, some version of, do you plan to become a parent in the next year? And if the answer is no, they should be offered really strong quality contraceptive counseling on the full range of methods, including the ones that you mentioned, really all methods of birth control, so they can really choose the method that works best for them. The training we do is for the entire healthcare team. This is not just for clinicians, it's really for the entire team to ensure that no matter why a patient comes in for care, they're able to get the birth control method they want.
Could we also go into why we have contraceptive deserts in the first place and what sort of factors? This might be a question for the Secretary.
So that's been historically just based on the provider type and not all primary care being comfortable, one, having the discussion about contraceptive in general, but then being knowledgeable about all the methods, to the point that was just made by Dr. Bruton. You know, maybe they only have oral contraceptives, which are generally hormonally based, but if a person wants something else, they may not be trained in offering an IUD, for example, and then you have to go somewhere else, which might mean traveling far distances to get an alternative contraceptive method. So this will expand our ability to provide services, since primary care is more accessible than some family planning and certainly OBGYN clinics.
Actually, I had an off-topic question for the governor. In Baltimore City, we had more than 200 people arrested over the past week during Thanksgiving week. There was also 18 kids who were arrested as well. I believe BPD said one of them is a 15-year-old who's been arrested 8 times. What is your public safety agenda going forward into the next legislative session? And also in DC, they declared a public emergency concerning juvenile crime. Would you consider doing that, considering all that's happening with kids at crime this year?
Well, I think that there's not a single state's attorney or law enforcement official who won't say that every single resources that they've asked for that we've been able to provide. You know, we have been working closely and in partnership with local law enforcement, with state's attorneys, with the U.S. Attorney, and also with the Attorney General to ensure that there are a few things that need to happen. One is for people who violate the law, regardless of age, there needs to be accountability measures. And the second thing is we have to make sure that there's greater levels of supports for our children so they don't end up going into that world in the first place. And so going forward, as we think about what the next legislative session is going to be, I know that the legislature is going to be helping to address certain items about, you know, whether it's laws that were previously passed before our administration came on board, or things that we need to be able to focus on, i.e. that's things like making sure we're addressing the issue of these illegal guns that keep on flooding into our neighborhoods, increasing accountability for people that violate the law, and also making sure we're having increased supports for our young people. Those are all things that we're not just going to address going forward, but frankly, these are things that we've been focused on since day one.
But would you declare a public emergency to send a signal to the public as well that the state is on top of this? There is a public perception with some that, you know, this is getting worse as the year has gone on. Would you consider declaring that, as DC has, as far as a public emergency concerning juvenile crime?
No, I think if people look at what we've been able to do, making historic investments in our local law enforcement, putting $122 million towards local law enforcement, $17.5 million towards Baltimore City alone, being able to strengthen partnerships with the state's attorneys all across the state of Maryland and the U.S. Attorney. I think people understand how seriously we take this, and I think people understand that there is nothing that we will not contemplate, and there is nobody who we will not work with to be able to make sure that we're keeping our community safe.
Governor Moore, going off of that topic, we know that there's another House committee hearing talking about juvenile crime scheduled for next week. We spoke with some delegates yesterday who they believe that based on where things stand now, that you and the Secretary of DJS are out of touch with this problem. Some conversations have been happening with making smaller tweaks to the juvenile justice laws specifically. I know you've said in the past that you will unveil your own juvenile crime plan. Where do we stand on that?
Well, I think what people know is that we've been working with individuals all across the aisle to be able to address this problem. We're very clear on the challenges that DJS has had that have been long-standing. We're clear that when we came into office, we walked into a DJS that was understaffed and underfunded. And it's the reason why I appointed a true reformer to be able to take over at DGS, someone who reformed the DGS equivalent in New York under Mike Bloomberg. And so it's the same type of expectation that I have. We have to make sure that we're getting the proper resources within DJS. We have to make sure that we're having proper accountability measures for individuals that break the law. And we have to make sure that the partnership between the state and the local law enforcement and local authorities is one that is strong, where we know that they play primary point on these issues, but they also know that they're going to have a partner in the state in terms of making our community safer and more inclusive.
But do you have a timeline for when the public will see your vision for this moving forward, leading on this issue before January 10th?
Oh yeah, the public will see our complete rollout prior to the legislative session.
When?
And we're working in partnership with both Democratic and Republican leaders to be able to ensure that the basic principles that we have laid out before, how do you increase accountability? How are we making sure that we're addressing the issue of illegal guns and how easy it is to gain access to illegal guns? And also, I know that the legislature is working on tweaks and reforms to laws that were passed before I became the governor that we want to see and we anticipate seeing.
All right, guys, thank you so much.
On the rails?
Sorry, guys, we gotta get announcements next to that.
Nice.
I want to know what they're going to do with Camden Yard. Ken came in with the off topic, and I was like, yes. I was just reading this morning the article that the Sun had about splitting